Welcome to the prostate surgery discharge video. In this video, we will be reviewing your discharge instructions, which includes what to expect and when to call your physician. You can expect to have blood in the urine. This is normal. The inner prostate surface is raw and healing from the surgery, and this causes a little blood to leak, which is expected. Blood is sort of like food coloring. A very small amount will make it look pink or red. Even though it seems like a lot of blood, it's very minimal. The color of the urine will change over the next 3 weeks, and for some patients, it's normal for the blood to persist for this long. You may have pink for 1 day, then yellow for 3 days, then red again for a few days. That's normal. The main thing is to look for is that the urine is thin and flows easily like water, even if it's red. Thick red urine that is more the consistency of ketchup, or if it has large blood clots. An occasional small clot is okay. Blood in the urine may be made worse by too much activity or walking. If you notice the blood in the urine is getting a little worse, that's a sign that you need to drink more water. When you drink more water or other fluids, it causes the blood to make more urine, which helps flush out the blood. Catheter pain, or blood at the tip of the penis. Some patients will have some blood drip from the tip of the penis around the catheter. This is common after prostate surgery and not a major concern. Tying a gauze to the Foley tube right at the tip may help soak it up. It should resolve in 48 hours. If you have burning or stinging at the tip of the penis, this is likely from the catheter rubbing and irritating it. You can apply any type of lube as needed to the tip. Lidocaine cream or gel could also be helpful. The catheter has a balloon that is filled up in the bladder to keep it in place. This can sometimes irritate the inside of the bladder and cause pressure, spasms, pain, or the feeling of needing to urinate. If you have the feeling, just go ahead and release like you're urinating. That may help relieve it. If particularly bothersome, medications such as oxybutynin may be helpful. Drinking fluids. This is the most important thing. The more fluids you drink, the more urine you make. You can bathe and shower with a Foley. Walking is okay and encouraged. Light everyday activities are also okay. What are the restrictions? No heavy lifting, exercise or straining for 3 weeks. Whenever you tense your core, such as when you brace to pick up a bag of groceries or hit a golf ball at the driving range, it increases the pressure inside your abdomen. At the bottom of your abdomen is the prostate. Increased pressure will push on the prostate and make it bleed more. This is why you need to avoid these activities. What happens if your catheter stops draining? The first step is to verify that it is indeed stopped draining. It can sometimes be confusing because it may feel like your bladder is full because of the catheter balloon irritation. The steps to take are: empty the bag completely, then drink 20 to 30 ounces of fluid and walk around. Wait 1 hour and see if any urine fills up in the bag. If it does, that confirms your catheter is draining. If it remains bone dry after 1 hour, that's when you need to urgently call your urology office. Go to the office or go to the emergency room. Eating. No restrictions on diet. After the catheter is moved, it is very normal not to feel 100% right away. In fact, some patients feel worse. That is because everything on the inside is still healing. Don't be discouraged. This means your body, prostate, and urethra just need more time to heal. You can expect some degree of burning, spasm, urgency, or frequency. It is common to have burning with urination when the catheter is removed. Burning is due to the inside of the surface healing and being irritated from surgery. Pyridium or azo can help with this, and tallow can also help relieve it. For some patients, this goes away within a week. If urgency and frequency is really bad, you might want to take some medicine to temporarily relax the bladder. Your urologist will direct this. One risk of any procedure like this is a urinary tract infection. How do you know if you have an infection? This can be tricky since the symptoms of a UTI is that of the prostate healing. Watch for a fever of over 100.5 Fahrenheit, feeling sluggish and weak, or a drastic worsening of symptoms that were starting to improve. Medication instructions. Prostate medications. Many patients are on prostate medications prior to their prostate surgery. Most urologists have patients continue them for a couple of weeks while things are healing, and then stop them about a month after surgery. Check with your urologist on their specific instructions. Blood thinning medications. This includes medications such as aspirin, Plavix, Eliquis, Xarelto, Pradaxa, and warfarin. Your urologist should give you specific instructions when to restart these medications. Do not restart them until you're clear on the instruction. Constipation. This is a big one. The rectum is actually right behind the prostate, and pressure from constipation can push on the prostate and make it challenging to urinate. Additionally, we want you to avoid straining as that can worsen bleeding. Anesthesia and pain meds also cause constipation. You should take stool softeners or laxatives for about a week or more after prostate surgery to prevent constipation and to keep the stool soft and moving easily. When to call your urology office. Thick ketchup-like urine with clots, fever over 100.5 Fahrenheit, significant weakness or dizziness, and if your catheter isn't draining. We hope this education increases the ability of you taking care of yourself at home. We will be calling you on post-op day 3 to see how things are feeling and ask you 5 questions. Thank you for taking the time to view this educational video.